All right, welcome to today's video. We're going to be talking about the application that resides on the tablet that we actually provide to the doctor and their staff. It's called mebo, and it's a proprietary application specifically designed for people in our field. And we're going to just do a quick demo on actually what the patient sees when the staff hands the patient the tablet in the waiting area, and the procedures that follow after, briefly. This module is not going to discuss what is required to get these tests approved by the doctor, but that will be covered in another module. Okay, so here's the scenario. Today, John Smith went to the doctor. The doctor wants John Smith to get some genetic testing for a PGX test because he's going to be on several medications. So mebo, the program, is going to actually ask John a series of questions that apply to not just the PGX test, but cancer screening, the CGX, and a beacon carrier test, okay? Also, this is again just a demo, but for your doctors that you're working with, they'll have questions that are pertaining to the Alzheimer's, Parkinson's, and dementia test as well. So here we go. This is what's on the tablet when the patient gets it. They just basically hit start now, but before they do, I just want to point out that this program or the app is going to be designed for that facility. And so it'll have photos of the doctors in the clinic or the hospital that are going to be using the system, as well as the information of the facility they're sitting in. So they're going to hit start now. So it comes up with some friendly stuff, kind of fun. And they're going to go ahead and just put in their name and hit the buttons as they come up, green to go. Now, it's going to come up with a list of all the carriers that we work with, okay? And some of those carriers may not be on the list because, we work with all major medical insurance companies. And again, the qualifications for that are not going to be covered. Just know this, that there have to be a PPO. There's some other programs. There's a couple HMOs, but those will be addressed in another module. But if by chance they have insurance that's not on our list, they can click this button, and it will ask them to go ahead and put their insurance provider. But for now, we're going to go ahead and say that we're a male, and the ethnicity question comes up. Now, just a side note, if we're going to assume that John's on Medicare, so that was a choice in the list, but let's just say that he said he pushed the wrong button or hit the whatever, it's okay. So he's a Caucasian, so he's going to hit the green arrow. Now it's going to ask some questions that, again, we know John's on Medicare, but mebo does not know that yet, as far as how old he is. So it's going to ask all the qualification questions for all of the insurance paid tests. So John, is your partner currently pregnant? No. Then John, are you planning to have a child or additional children in the future? He's of Medicare age, so the answer there is going to be no. Now, John, have you ever been diagnosed with cancer? And he may be in there for the PGX test, but we're going to go ahead and say that he had a cancer diagnosis. And we're going to say that they picked from the list that he had colon cancer, or none of these, okay? And if it's not on the list. So how old were you when you were diagnosed, John? Well, he was 53. Okay. And then it's going to ask if he's had any other cancers. Okay. And we're just going to keep it at that and keep it simple. Are you sure you've selected all the cancer types that you've been diagnosed with? Yes. Now, has anyone in your family ever been diagnosed with cancer? We'll just say for this exercise that somebody else has. And we're going to say that colon cancer runs in his family. And we're going to pick a family member. It gives us some options here. Brother, aunt, we're going to say that was his uncle. Now, if you're not sure how old your uncle was when he was diagnosed with colon cancer, please enter your best estimate. So we pick a side of the family that the colon cancer came from. We're going to say it was from Dad's side. And he was diagnosed at 48. And then click Done. Do you have any other family members that have been diagnosed with colon cancer? We'll say no. Now, if there's no other choices to be made here, they can just click the green arrow. John, are you sure? He's going to say yes. Here's a little review, a summary. Now it's going to ask the medication questions. John, are you currently taking any medications? Yes. What are you taking, John? Well, we know he's taking Xanax. And as you start to type, it'll bring up choices. Taking any more? Well, sure. He's got some diabetes going on, so he's going to put metformin in here. We're going to add that. Another one, we'll just say he's taking this drug here. We're going to add that one there. And keep going and going and going with all of his medications. Now, as you can see, not only does it populate with the medications, but it actually tells you what categories they're in. Okay, so this one's psych, there's another psych, and here's diabetes. I think we're good here. Now, do you experience any side effects from one or more of the medications? If he says no, then he'll click no, but let's just say he does have some. He'll go through here and go through the list, give him several screens. So let's just say he has an anxiety kind of a thing going on here. So he's taking Xanax anyway. Nothing on this list. Now it's going to ask another cancer question. Has one of your family members tested positive for a BRCA or Lynch mutation in the past? He doesn't know, so he just picks no. Now it's going to tell us that he qualifies for the CGX test. He qualifies for the PGX test. It's no surprise that he does not qualify for the beacon carrier screening here because he does not plan on having children in the future. So he's going to click next. Now it's going to get some vitals from him, some information. So we're going to say that this kid was born in, I don't know, let's pick one here. And he has a social security number. Click. Okay, he's a male. His address, we'll just say that it's 123 Main Street, and we'll say he lives in Watertown, Massachusetts, okay? Cell phone, optional phones, email. We always try to get one or tell them to get one, so we'll say John Smith. His insurance carrier, now what he's going to do is he's going to put Medicare here now. He's going to put his member ID and any other options that are on the card that are present. His height, we'll say he's, I don't know, 5 foot, 11 inches, and he's been working out, so we'll say he's 220. All right. Now, who's the policyholder? It's John himself. Now, at this point in time, because it's a tablet, John will have out his insurance card, okay? And we'll click to scan it, basically, and it'll take a picture with the camera on the tablet. And then it'll do the same thing for the back of the insurance card, okay? IDs as well will be in here. So we're going to say he did all that. And now it's going to bring up some really cool information here. Cool information being the patient consent. So they'll read this, some of them won't. Okay, read through it. Some questions that they can answer by clicking boxes. John has decided that he's going to allow his de-identified data to be used in the research. Okay, he does not have to. He has to opt in for this. It's not automatic. And then he also has to agree with the terms. So when he clicks the button, now clicking the button on a tablet is basically using his finger and pushing the screen. Now he'll take his finger and then he will sign his name and click. Away we go. Now, as you can see, it's thinking. Now at this point in time, John's going to take the tablet back up to the counter. Okay, imagine he's in a waiting room, and hand it to whoever gave him the tablet before, nurse or assistant. That nurse or assistant is going to go ahead and take the device and click the button. Now, it's going to say, fill out doctor, do not fill out doctor, fill out ordering provider. Okay, this is the standard select. Okay, and we're going to choose a physician. We'll just click on this one here. It's got some billing codes. They could add any other additional billing codes. Now again, this is for the staff, not the patient. We could hit save if we wanted to. And that'll save to the device. Now we'll do a preview print button. And now it will populate on the tablet with the rec form for CGX, because that's what they qualified for. And it'll automatically populate the doctor's information, copy the patient's signature, a letter of medical necessity, the consent form again. Their signature shows up on the consent form. So CGX, now if the PGX prints out, again, ready to go. All the doctor basically has to do is sign off on it. Okay, and some other pictures here that are not populating right now for this demo. All right, so what happens next? Well, what happens next is the doctor prints the form, or the nurse. The doctor signs the form. They put it in an envelope with the swabs that the nurse will have collected from the patient and put it in the mail. It goes directly to the lab. The lab then sends the results to the doctor or the patient, however we have it set up, or both, and it's done. 100% compliant, 100% efficient. Doesn't get any better than that. So look for the other modules here in the video training section of the website to show you the qualifications for all the insurance paid tests, as well as the carriers that we work with and any caveats that are with those. So thanks for watching, and